Hello, my name is Kristen. I'm going to discuss dental cleanings for dogs today. Have you ever taken your pet in for their annual exam and your veterinarian recommended a dental cleaning? Have you noticed that your older dog's breath is just a little more smelly than it used to be? Well, it might surprise you to learn that your veterinarian is recommending dental cleanings for more than just the odor. Regular dental care is actually a vital part of ensuring that your pet lives a long and healthy life. Your veterinarian is not able to perform a comprehensive oral exam without the help of general anesthesia. Additionally, the bacteria populations from periodontal disease can have a detrimental effect on the body's other systems. Advanced dental disease often becomes a consideration in end-of-life conversations for older pets. Once an animal has other comorbidities such as cardiac disease, they become no longer able to go under anesthesia and their periodontal disease would have to be left untreated, which leads to discomfort and often lack of appetite. I've been working in animal dentistry now for about 10 years, and it has definitely become a passion of mine. I get to see pets go home every day feeling happier and healthier now that we've gotten rid of a source of discomfort for them. By the end of this presentation, I hope you will understand the importance of getting your pet's annual dental care. We as humans go to the dentist once or twice a year, but you may not realize that your dentist is looking at more than just your teeth. They're examining your oral cavity for other abnormalities such as inflammation or masses. However, when we go to the dentist, they can just tell us to say and they can see everything that they need to. We can't do that with our pets, so that's why we need to utilize sedation. In dogs and cats, oral masses are frequently found below the tongue and in the back of the mouth, which we wouldn't be able to see on a regular physical exam. And I brought in an example of that. This is actually an oral mass that we found. You can see it's sublingual, it's beneath the tongue. We found that during a dental cleaning. It was not seen on yearly exams. We see this kind of thing a lot. This did end up being cancerous. In a study published in 2018 by Julia Rich, it was found that 5 to 7% of all malignant cancers in dogs are found in the oral cavity. If a patient is receiving only an awake visual exam yearly, it may be likely that small tumors are missed until it is too late for them to be removed surgically. Beyond this, it is also believed that the oral bacteria population play a role in tumor progression, suggesting that having better overall dental health may reduce the risk of oral neoplasia. When considering the benefit of finding and excising oral masses early, anesthetic examinations become an invaluable tool for extending the lives of our dogs. Just like your veterinarian may not be able to see signs of oral cancers based on an awake exam, they also cannot see without x-rays what's going on below the gum line. Obvious findings like large fractures or loose teeth can be appreciated. However, during an anesthetic cleaning, a set of radiographs will be taken that will allow us to assess the rest of the tooth. In a study in 2018 conducted by Amy Bauer, they looked at the relationship between physical exams and what we got when we did dental radiographs and a full cleaning, and it was found that a physical exam alone is only 41.57% effective, meaning that over 50% of dental disease was missed on physical exam. Common problems such as tooth root abscesses, resorption of the periodontal ligament, can be found on radiographs. Additionally, the doctor is going to probe around every tooth to look for pocketing, to see any places where bacteria can hang out. And I brought in a couple examples. This is an example of something that is very obvious. You'd be able to see this on yearly exam. You don't need radiographs to see something like this. But this, on the other hand, this is a set of radiographs. Both sides are the same patient. These two teeth are the same teeth, so you can see how this one has two healthy roots. This one's totally missing a root, and it has this black area here indicating an abscess. Both of these teeth look normal on physical exam. Many pet owners may not realize that the same bacteria that's hanging out in the little pockets causes issues in the rest of the body. One of the most common correlations has been between periodontal disease and kidney disease. In a study in 2014 published by S.U. Nabi, they looked at the relationship between periodontal disease and biomarkers in the blood for renal disease, and observed a causative association between periodontal infection and chronic kidney disease that they believe warrants considering severe periodontitis a risk factor for CKD, which is chronic kidney disease. It is for these reasons, not just your dog's stinky breath, that your veterinarian is recommending dental cleanings to you. Even with all of this information, many owners still have reservations about putting their dogs under anesthesia. It's important to discuss the precautions that are taken to give your pet the best chance of success. And what that looks like is your pet's going to get a thorough physical exam prior to anesthesia. They will be able to tell if there's any new heart murmurs or suspect any conditions going on that you may not be aware of. They will also run a set of full blood work to check for kidney and liver values, because anesthesia is metabolized and processed through the kidney and liver. So if those are compromised, we don't put them under anesthesia. Additionally, on the day of anesthesia, your pet is monitored typically by a total of 3 staff members, and they're on all the same monitoring that a human would be. Blood pressure, oxygenation, we've got control of the respiratory tract. Because of all these precautions, most complications are caught very early and rarely become life-threatening. If you have a good relationship with your vet clinic and they're following these precautions, there's no reason that your pet should not be able to go under anesthesia. The next time your vet reminds you that it may be time for your pet's dental cleaning, remember that this recommendation is about more than just fresh breath. In order for your veterinarian to detect dental disease and oral cancers early, they need to be able to fully examine the oral cavity. If left untreated, dental bacteria can end up causing harm to your pet's other organ systems. At the end of the day, your pet will come home to you, and you will be able to enjoy some fresh kisses and a long, happy life together.